Hey, good day. This is Eric Gerritson from MGM Werx, and welcome to the studios of MGM Werx in Montgomery, Alabama. This is Werx on the Web. Today, I have a special guest. It's a treat for not just me. I think it's going to be a treat for you. I've known this guest for about a year, and her and I have worked on a project which she's going to explain. When I say worked on, she's the brains. I just facilitate a little bit, but she's brilliant. My friend's name is Peggy Sammon. Peggy, how you doing?
Good, Eric. Thank you. Hello to you.
Well, thank you very much. I appreciate you being here today. You're coming from Huntsville, is that correct?
Huntsville, Alabama.
All right. Well, welcome to MGM Werx and Werx on the Web. So, Peggy, this is an opportunity for you to talk about GeneCapture, the company you work for. You want to go ahead and tell me, what is GeneCapture?
Yeah, GeneCapture is a product development company, and we're working on a revolutionary product. We're building an infection detection system that can work outside of a lab. So our mission is to screen a human sample for 200 different pathogens, germs, in less than an hour for less than $20. And so the goal here is to be able to have a patient that arrives and we don't know what the problem is, and our system will very quickly determine what infection is causing the problem. So today, it's obviously an important issue that's on everybody's minds, but without a pandemic, it's a very important issue. It's just not always front page news.
So I'll just let you know, and I believe I've shared it with you in the past, but the 200 pathogens for $20, that gets everybody's attention when I talk about GeneCapture, because the cost of healthcare, which we'll get into a little bit here in just a little while. So I think where you guys are going, this is revolutionary, and I'll say it this time, and I'll probably say it a couple more times. You're going to change the world with this, and that's why you're on the show today. So Peggy, what is GeneCapture? What is this revolutionary product you're talking about?
Yes, and I do feel we're going to have a very big impact, and I feel very honored to be part of this team. I'm on the business side, so my hat's off to the scientists who have worked on this. GeneCapture is a company that has a product that is basically two pieces, a small plastic cartridge and a little reader instrument. And we have found a way to take a sample, whether that's blood or a swab or urine, and in very few minutes, release the molecular genetic material, the DNA and the RNA from that sample, and capture which piece it is, which allows us to know which pathogen it is. So in about 40 minutes, we're able to take a sample and then come back and say, this particular pathogen is in that sample. So it's an awesome accomplishment.
It absolutely is. And so speaking of awesome accomplishments, how did GeneCapture come about?
Well, years ago, I met the original inventor, Dr. Krishnan Chittoor, and he was at the time a chemical engineering professor at UAH. And I was helping scientists with business plans and funding plans. And I met through a mutual friend, I met Krishnan. And Krishnan told me that a few years earlier, his daughter was born prematurely. And at about the less than 1 day mark, the doctors came into the hospital room and they said, we've taken a look at an x-ray of her lungs. We see some shadows. We think she has pneumonia. And so the best thing we can do is start antibiotics right away and try to get on top of it. And so Krishnan and his wife were so nervous. Here's a little preemie baby. They had 3 suspenseful days, 1, 2, 3. It took a long time to get the results back. And after 3 days, the doctors came back in and said, great news, she does not have pneumonia. We've stopped the antibiotics and we're ready to move forward. And Krishnan thought, yep, that is great news. I'm thrilled. But, we have just pumped strong antibiotics into an immune system that is still immature. And what is that going to do for the rest of her life? And as it happens, his daughter is a healthy teenager now. But the question was a really good one, and that stuck in the back of his mind. He thought, how can it possibly take 3 days to figure out what is causing an infection? There's got to be a faster way. And in one of the experiments in his chemical engineering lab, a few things came together, and a team of about 4 of them said, you know what, this actually is a quick way to figure out what the genetic signature is in a sample. And that's what got the whole thing started.
So it's amazing in the innovation world the world that you're in, the world that I work in, is that innovations often happen because we're forced to go there. Something occurred. It's not that somebody just thinks of a brilliant idea, but this situation occurred, and that's where innovation comes from. And it's in his case, I'm sad that that occurred for him, but it's really a benefit for everybody else where GeneCapture is coming from. Okay, so you got GeneCapture, you've got the product and it's in development, but you need a team of folks to help you get to where you need to be. Tell us about your team.
So right now we have about 10 employees on our team. This picture was taken when we were celebrating a major event a little over a year ago, and that was the signing of a mentor-protege contract with funded by the U.S. Army. But our team is primarily some experienced scientists and engineering managers and technologists, and then a group of young, very energized, recently educated biologists, biomedical engineers, and chemical engineers. And this group of us have organized the building of the prototype, the lab experiments that have to be run, and it's a great group of people to work with. I'm really, really pleased and lucky to be with them.
Did you recruit them all out of Huntsville?
Everybody on our team has a Huntsville connection, yes. And although today we're doing a little work from home, we're generally all involved at the Hudson Alpha Institute for Biotechnology in Huntsville. And that's a really interesting public-private partnership that is a research institute, but companies, 40 companies now, have been selected in to do startups and early stage companies, early stage products there. So we're in that institute, and Huntsville's really known for aviation and missile defense, but it is really becoming known for biotech now as well.
So, first of all, it's exciting for me living in Montgomery, Alabama. It's exciting, these great things that are going on in Huntsville. But as we get into this discussion a little bit more, we're going to go from big Alabama, Huntsville, and we're going to go down a little bit, and we're going to talk about the product itself and what you guys are looking for. So you want to go ahead and address this this picture here.
So this is a really interesting little mini video. It's just 30 seconds long, and the credit goes to University of Utah. But I wanted to have your audience appreciate how small it is that we're looking for. So Eric, you can go ahead and kick it off. And what we're looking at right now is the size of a coffee bean. And then you see a grain of rice. And we are just going to go smaller and smaller and smaller into this world. So now you see there's an amoeba, paramecium, size of a human egg. We're moving down further and further down the size, red blood cell, and now there is a bacteria. So that's a bacteria, but we need to keep going further for viruses. There's the virus, but we're not there yet. We've got to get to the RNA inside the virus. So I thought that was a helpful visual because what everybody's trying to do now, whether it's COVID-19 or any kind of molecular diagnostics, we're trying to find something really small, very accurately and very fast. And so it's a challenge.
So you had mentioned that you have a demonstration that you would like to do.
Yes. Let me show you what the core mechanics of the discovery that our team has made and how we use it to figure out which pathogen we found.
All right, so Peggy, you're going to do a demonstration. You've left your seat in front of the computer and you've moved over to your demonstration area. What are we looking at right here?
So what we have right here is what we call a stem loop probe. This is the stem, and here's the loop. And each of these little foam pieces here represent one of the 4 nucleic acids that are in the molecular system. So there's 4. We call them A, T, C, and G, just to make it easy. And so one of the interesting things about molecular diagnostics is A's bind with T's and G's bind with C's, and they don't misbind. So when you know that rule, there's a lot of things you can do. So let's say, for example, that this probe, which we have on a small slide array, is designed to capture a staph infection. And so in the sample, here we have a staph infection. And this is the genetic material from that. So it's going to bind exactly on here. If it doesn't bind exactly, it will not do this next step I'm going to show you. So we've got this all bound up here. And once this is bound, the the strength, this upper loop becomes much stronger than the strength of the stem. So this binding begins to do that twirl into a DNA helix, and it pulls this stem open. And once it pulls it open, we have a second little universal marker that comes in, and this only attaches to the stems that are open. So this comes in here and attaches, and it has a fluorescent marker on it. So when this is all finished, we image this little array, and wherever it's glowing, that means that's where we captured the right piece of material. If that material is not captured, the stem stays closed, and there's no opportunity for the fluorescent molecule to be there. So that's the heart of the system. That's what's patented, and that's the heart of the system we've used to very quickly identify what signature is in the pathogen.
Well, Peggy, that's absolutely fascinating. I wish I would have paid attention in 7th grade science. I can remember my teacher's name, but I can't remember anything else.
I can't tell you how much I've learned about biology by being in this role, so I feel for you.
Yeah, well, I'm a product of the Los Angeles school system, so that put me at a disadvantage right off the bat. But anyway, that's another story for another time. All right, so Peggy, you've explained it now, and by the way, the demonstration was just absolutely fascinating. But let's talk about now the equipment that you use to find the problems. So can we talk about that?
Yes. So the reader box that we have right now, and you're seeing a picture of it on the screen, is kind of big and clunky. We expect it to be small and portable at some point, but today it's sort of the size of a medium-sized microwave. And that system, that inside that box, we have a little bit of mechanics that moves the fluid through a cartridge so that it can do that binding that we talked about, and a camera that can take an image of where the fluorescent material is. So that's where we've started. And now we have moved in the last year, we've made a major accomplishment. That little cartridge that you're seeing in the picture has been modified significantly. And now we are using a cartridge that actually preps the sample. And this is something I didn't realize till I got involved with GeneCapture, but sample prep is a big part of the infection detection business. It's once the sample is prepped, you can go in and find what the material is, but it's getting the sample ready to be prepped. So this new cartridge that we have takes a direct sample in, blood, urine swab, and in the first 10 minutes of the process, it actually breaks all those cells open, releases the genetic material, concentrates it, fragments it, and gets it ready to go over that array with all the little stem loop probes. So that's our new accomplishment, and we've been doing this under an SBIR contract with, actually an STTR contract with DTRA, Defense Threat Reduction Agency. And we're working with them to help develop this technology so it can support the warfighter in conditions where they don't have access to a field hospital or sometimes even a medic.
First, let me explain to the viewers, you may not know, STTR is, Peggy, can you tell them what STTR stands for?
So STTR is a small business innovative research contract or grant that is associated with a research institution. In our case, we're associated with research that's being done at Southern Research in Birmingham. Very often it's with a university, whereas an SBIR is the same spirit of a small business innovative grant, but done without having a connection to a research institute.
Sure. So STTR, Small Business Technology Transfer, basically is what's going on in that. In that case, there is some differences there. And if you want to know more about that, you can go to our website, www.mgmwerx.org, and you can find out more, or just shoot me an email. All right. So, Peggy, you've come a long way, but you used the word a couple times, prep. What do you mean when you prep a sample?
You know, if you think about a tube of blood, there's a lot of material in there. There's a lot of cellular material, there's proteins, there's a lot of stuff that's in the way of what you want to look for. So some systems require centrifuging or heating or something that requires lab-based equipment. Our goal is to prep that sample in the cartridge so that it's truly point of care and doesn't require any special lab technology or technicians.
So that actually adds to perhaps the 20 minutes time frame. I mean, cutting things down in the laboratory because you're prepping it right there.
Yes, it's very effective to prep it right there. And, you know, another scientific principle here is that we're trying to capture the RNA, which is part of the molecular signature, and the RNA is rapidly changing. So we want to have a closed system where the sample goes in, we do that analysis quickly, and we capture the RNA while it's still available.
All right, so tell me, what does this mean to the mom, to the dad, to the hospital? What does this mean for them compared to the way it's done today?
Well, today it takes about 3 days under most scenarios to get the results of an infection detection test. You go to the doctor's office, they take a sample, that sample gets sent to a local lab. It's grown up in a petri dish, and in 2 to 3 days, trained technicians can tell what the sample is and generally which antibiotic, if it's a bacterial infection, is going to be best for it. There are some more rapid technologies that are in major hospitals and large labs, and they are much more expensive and but faster. But some of them can give you an answer in anywhere from 3 to 6 hours. And the issue is you've got to get the sample to them. So they may be in a downtown hospital or in a major lab. What we're trying to do at GeneCapture is break that mold and actually have everything be at the point of care. So these little machines that we're developing and the cartridges would be at the doctor's office, at the clinic, at the border, in a university, but where the infection detection is taking place and not having to move the sample someplace else. So our job is to cut down on the time. And that, from a product and market standpoint, that is the problem we're solving. We aren't developing a vaccine. We're not solving the infection. We're taking what generally takes approximately 3 days, and we're getting it down to 1 hour. In the military environment, this can be more than 3 days because sometimes the warfighter is in an area that is a long ways from a hospital that could do that kind of an analysis. So it would make a big, big difference.
Yeah, we're going to talk about the military implications here in a minute, but I'm thinking a little bit about an urgent care. So let's just say that my daughter, she's sick, and I take her to an urgent care. Can anybody, could it be just a lab tech? Could it be a nurse practitioner, a nurse, a doctor? Who can read the results, or does it come out that does it print out something that says, hey, you've got bam? And
yeah, our goal is to have what's called sample in, answer out. So it should not require a trained medical technician. It should be a simple, one button push, and 35, 40 minutes later, you get the answer for what the infection is. So when I say our goal, we're a development company. We've got a working prototype. We've got some very good early clinical results, but we are still pre-FDA. So we're developing this technology to hit the quality metrics that you need to be cleared by the FDA for commercial applications.
So I can imagine right now with the situation that we're in, or actually globally with COVID-19, that the FDA may be more open and streamlined, where you might be able to move through the process of FDA approval because of what's going on today?
Actually not. But here's where the FDA has opened up their gates a little bit.
Okay.
From FDA's perspective, we're sort of in a wartime footing. And so they're saying we'll provide emergency use authorization, so it's EUAs, for anybody that can come up with a reliable COVID-19 detector to help us right away. But if I'm looking at other things like pneumonia and E. coli and MRSA, they won't fall under the EUA. But if you come up with a rapid COVID-19 detector, yes, they are moving things much faster through the system. They've relaxed some of their rules just because it is just such an urgent crisis.
Gotcha. Okay, so we're going to touch on COVID-19 here in a second, a little bit more if you don't mind. So let's talk about this, the existing and enabled markets. Explain how you are impacting the markets today on this slide.
Well, on this slide, I'm just showing that today most infection detection takes place, let's say it's in the United States, in about 6,000 hospitals or 1,000 large labs. And if you can imagine this technology being portable and accurate and inexpensive, it opens up a very large enabled market so that this technology could be in the 100,000 clinics, the doctor's offices, the nursing homes, the universities. Mm-hmm. And then the government line on that second line there is, ports of entry, field hospitals, air and shipping ports, public health departments. So all of a sudden, infection detection can move way out beyond where it's done today, which opens that market up to a much larger market. And then the ultimate enablement, and I'm really excited about this part, is once this technology is adopted and in use, then you can imagine data that can go to a central location and be basically a global infection monitoring site. So you could have a database that is popping up where infections are in the world, and you can see them happening in the real time. So, I think it's interesting that when you buy a package, you buy something off Amazon, you can tell where your package is all along the way. You can't do that with infections today because of this 3-day lag time. So we're trying to get that down and then open up entirely new markets.
Good. I keep hold that thought, because we're going to go back to how quickly you can help globally here in just a second when we talk about how the military can use GeneCapture technology. Now, listen, I heard, and congratulations, by the way, I heard you recently won a spot in the X Tech Search Accelerator. Tell us about that.
Yeah, this is a competitive selection by an accelerator that is funded by the U.S. Army. And it's one of the many approaches in the U.S. military to basically take technology and move it fast. So there's 10 companies in this accelerator. We are thrilled to be part of it.
Wow.
And this accelerator focuses on how to take technologies and actually communicate effectively with the U.S. Army. But they're looking for technologies that have a commercial application as well. So in addition to a very disciplined curriculum, we also are each provided with a series of mentors that help us in the government side, the commercial side, and general technology side. So it's a 6-month program. It just started. The highlight will be at the AUSA conference in Washington, D.C. next fall, if that's going to be taking place. But it's a really cool group. It's a neat group of other companies and very helpful mentors.
So you're one of 10 that was selected to be part of this.
Yes.
How big was the field? Do you know?
About 350.
That's just amazing that you had that opportunity to be selected, and congratulations to you. And
thank you. We feel very fortunate.
Yes. Okay. So let's move into COVID-19 a little bit more. What else can you add about GeneCapture, COVID-19? Where's the gap? Are you going to be able to support COVID-19 right now? What's going on with that?
Well, our thesis is that we look for many infections at once. And I showed you that little stem loop probe, so you know how we do that. And so we've never really felt that we were going after one infection at a time, which is really what you need in a pandemic. So in a pandemic, you're not trying to find out, does a patient have E. coli or salmonella? You just want to know, is it COVID-19 or not? So we've set up a little skunkworks project to take those stem loop probes that I showed you, and instead of having them on a microarray where you can look for many things at once, we're experimenting with concentrating them in a small paper sample and seeing if we could be fast enough and sensitive enough to find the COVID-19. So we've done some early studies. We've got some promising early data, and we're trying to see if we can get it to the point that it is worthy of an FDA EAU, emergency use authorization. So we are working with a number of government agencies to see if this is the type of project that they would fund. We're trying hard not to be completely distracted by this as a company, because we have a strong focus on this multi-pathogen approach, but we just felt as citizens that we wanted to help. And if we have a quick way to do COVID-19, we will push it.
Well, speaking of citizens, let's talk about the impact on the military and the citizen soldier, the citizen airman, and the active duty components, and how GeneCapture could interact and support the military. So let's talk about the time you came down. I believe it was in August of this past year when you came down to Montgomery with the team. And would you talk a little bit about that visit?
Yes. And, I'd met Steve Werner up at the Hudson Alpha Institute maybe a few months earlier. And then we had reached a point on our product design where we really needed a lot more user input. And that's when I called down to Werx to see how your program was working, and could you help us bring together some users? And it was a very high impact meeting. It was actually a real turning point for us, because your team brought together actual medics and commanders and operating folks from different points of view in Air Force and special operations. And we heard firsthand, which is just the way to do it. We heard firsthand what kind of issues they had in the field and where infection detection would really make a difference. It's partly for warfighters and partly for humanitarian exercises. So it was actually a really interesting meeting. And from that, we layered out to many, many levels of networking that has helped us a lot. So that type of support to small businesses is super appreciated. And yeah, I would say from there, we moved to other, with the connections that we made there, Eric, we moved to other Air Force bases, and we did some specific work on Air Force, and we were successful in winning an AFWERX Phase 2 contract to design a more rugged reader box for our system. And we credit a lot that came out of that early meeting.
Well, I tell you, MGM Werx is excited to be involved in these kind of things. And I can't tell you personally how much it meant to me and to all the folks that I had invited, because we had members of the 20th Special Forces group there. We had the Snake Eaters. We had folks from the Civil Support Team, Alabama National Guard, that were there, PA, docs, medics, lab technicians. Then we had a nurse from the Air Guard. We had a loadmaster from the Air Guard, and then we had some medics from Air University that were there, along with a public affairs person. So it was a great mix of people coming from very diverse military backgrounds. And I remember listening to them, and what you would get from the Special Forces guys is different than you would get from the PA doc, is different than you would get from the men that came over from Air University or from the nurse that came over from the Air Guard. Everything was different, but they were constantly saying, hey, you ought to take a look at this and take a look at that. And your team was so receptive to what they had to say. And so it was just a very exciting time to watch that all take place.
It was really interesting, and a lot has come from that, and we've reached back out to those people. But also I'd say to have that quality, I agree with you, as a very diverse group, but to have that quality of people for a couple of hours in the same room was just a treasure.
Right. And MGM Werx, by the way, for those who are watching, MGM Werx will support you. Perhaps your organization, perhaps your company. If you need a similar event to take place, give me a call. Talk to me, because I can help bring you and potential customers together. But we got to talk about it first. Okay, so you had talked about how you can militarize this, shrink it down, and make it so it can go to the fields. So let's go to this slide right here. And what I'm looking at is the GeneCapture device going from the lab into a briefcase.
And that's really a lot of what came out of that early meeting. Is we're trying to design that early meeting with your staff, your group. We were trying to design our roadmap for how this is all going to play out. And I want to give a shout out to the military here. You know, when we first started this company, we had very much of a commercial focus, and we still do. There's a very large commercial market, but the military has been more forward thinking and more challenging about what to do with this equipment. They were the first to say, we want something that's going to be portable, battery powered, can operate in austere environments. Yes. And so they really have helped push this technology. So years ago, we applied for an early STTR Phase 1 through DTRA and ChemBio Defense. And that's where we got this early sense that they wanted to go from a lab device to a transportable device to a backpackable device. So that's our hardware roadmap. And then from the cartridge side, we will just continue to add pathogens. So from a commercial standpoint, we're looking at the urinary tract infection market as an early launch and a biothreat panel for government. And then we'll just add more and more pathogens as we come along until we get up to approximately 200. So that's just to give you a feel for how this path works. But the military's real interest is supporting the warfighter and supporting the whole team for readiness. Because if you have a warfighter get infected and have a fever, the medic doesn't know if they should quarantine them, evacuate them, treat or return to duty. Those are hard decisions to make, and you want to make them quickly, and they're dangerous decisions to make. So the quicker we can let that medic know what they're dealing with, the better.
Absolutely. So when I talk about your product, and I do talk about your product a lot to very diverse classes that come in, or groups of people that come in, this is what I basically tell them. I said, imagine if a nurse, a doctor, a special forces person can hop off a Black Hawk, hop off a C-130, walk into a village anywhere in the world, third world, second world, it doesn't matter. And if there potentially is something going on, could actually test everybody in the village in a short short period of time and come back with information that can support the WHO, the CDC, the military, the host nation, wherever it may be. It's just amazing technology that can actually change the world. And you had talked about one of the markets is the WHO.
Yes, yes. And that, those conversations came up. I'm just going to go back one more time to that meeting, but the humanitarian side of this came up in a strong way at your meeting. Not only is it sort of the winning hearts and minds side of all this, but it's also protecting the warfighter, because the warfighter is in places where you don't know what the infections are. So being able to test people there is also a precursor to what the warfighter is being exposed to. But yes, this is definitely a global issue, and the World Health Organization is I think, very important to trying to develop a plan for how infection is dealt with on a worldwide basis. I mean, right now, all of our energy is going to our as a country and as a globe to COVID-19. But
right.
Outside of that pandemic, there is a real issue on infection detection, and one of the reasons is antibiotics are not as effective as they used to be, and there's not as many antibiotics as we need in our suite to take care of bacterial infections. So if you know exactly what the infection is, you can choose the right antibiotic. Every time we're given the wrong antibiotic, we make our personal system a little less strong and a little more susceptible to new pathogens.
Peggy, fantastic. This is, like, I can't say it enough. Is world-changing, life-changing technology. And I'm so excited to have you here. But I have another question for you before we wrap this up. I know that you, as a small business, pretty new in the business, you've been around for, I believe you've been the CEO for 7 years or so?
Yes, we're a little older than 7 years, but in the last 7 years, we've been working hard on building the product.
Absolutely. But if you had an opportunity to get in front of somebody with the secret about GeneCapture, who would you want to get in front of and why?
We've been fortunate to talk to a number of different agencies in the military, but I would say a group that we want to spend some time with is the World Health Organization. So the WHO is actually, I think, a very important place for us to start building a relationship, and we're new there. So some help on that front would be terrific.
I could only say the only WHO I know is Horton, and he hears a WHO. That's the only WHO I know, but if I come across any folks from the WHO, I will certainly send them your way, and I'll talk about your technology too. All right, so Peggy, any last thoughts before we wrap this show up?
No, thanks very much I've enjoyed the conversation, and I appreciate it, and I hope everybody stays healthy out there, and in the future, whether it's you or your children or grandchildren, I hope you're able to take advantage of our technology someday.
Well, I'm looking forward to seeing it in the market, the commercial market and the military sector also, because that really is where success is going to be, is the dual use technologies. All right, so Peggy, thank you very much for your time today. This is MGM Werx. We've been talking to Peggy Sammon, the CEO of GeneCapture out of Huntsville, Alabama. If you want to know more about GeneCapture, Peggy, where can they find out more?
On our website, GeneCapture.com.
GeneCapture.com. And if you want to know more about GeneCapture, maybe you don't find something on there, or you want to communicate with Peggy yourself, let me know. Shoot me an email, egerritson@mgmwerx.org, and I will go ahead and let Peggy know you're trying to get a hold of them, and perhaps we can get that conversation going. But with that said, Peggy, thank you very much for your time today. Thank you very much for being here and watching this today. This has been Werx on the Web with Eric Gerritson, your host, my producer, Becky. That's Becky Gerritson, my wife, actually. Joshua, producer. And again, I thank you very much for being with us today. Thank you.
Goodbye.